We're still seeing a surge in coronavirus cases. In fact, the Arizona Department of Health Services is now reporting more than 4,400 new cases, and that's just today alone. More than 100 new deaths were also reported. But DHS says a large percentage of those deaths reported today are due to death certificate matching. So take a look at this graph. Over the past month, we've seen an extreme upward trend in coronavirus cases. And as you can see here, at the beginning of November, daily new cases were at about 2,000. But now they're averaging more than 5,000. More COVID cases means more people in the hospitals, and that's becoming a huge problem here in our state. Even the White House Coronavirus Task Force wants state leaders to do more. Team 12's Colleen Sikora shows us just how Arizona hospitals are handling this second wave.
It's been a long 8 months.
I think we're exhausted.
And if you ask Valley ICU nurse Sierra Holloway,
We are in a balancing act of trying to maintain our capacity.
the most recent increase of COVID-19 cases in Arizona is proving just as trying.
The patients, are very different. They're much more complex this time around.
COVID-19 patients are in 43% of all ICU beds in use right now in Arizona. Data from the Federal Department of Health and Human Services shows people going to the hospital for COVID-19 started going up exponentially in Arizona hospitals back on November 6th. Banner Thunderbird had an increase of 242% of COVID-19 patients over November, and Mountain Vista Medical Center in Mesa had 354% increase in patients in the same time period.
Since Thanksgiving, we have seen an increase of our not only our COVID cases, but our non-COVID critical care cases.
The White House Coronavirus Task Force recommending in their Arizona report that mitigation efforts must increase, adding specifics like ensuring masks in public and reducing capacity or closing places like bars and restaurants. Governor Doug Ducey last week set money aside to help expand outdoor dining and has kept indoor capacity at bars and restaurants at 50% and set money aside to help get more nurses to Arizona. But Don Cato, CEO of the Arizona Nurses Association, is still concerned over what's to come.
It's going to be pretty much a battle for who gets the nurses in which states.
Knowing nurses in all floors of the hospital are being stretched.
Those nurses, although they're not in the ICU, they're being stretched as well because they're taking on more complex patients and more patients than what they typically would have as a patient load.
All right, Colleen, thank you.